Groin pain, pain in the hip joint, inside the pelvis, on the inner and front surfaces of the thigh can occur due to issues with the adductor muscles of the thigh. In this video, we thoroughly discuss the causes of such pain, simple exercises that can help relieve discomfort and prevent the pain from coming back. I'm Dr. Chernoff. Let's figure out how to quickly get rid of this pain. The group of adductor muscles of the thigh includes 5 muscles: the pectineus muscle, the long adductor, the short adductor, the large adductor, and the gracilis muscle. In this video, I will take a detailed look at deep groin pain, pain in the hip joint area, as well as pain along the inner thigh that comes from trigger points in the pectineus muscle, which is the highest positioned adductor muscle of the thigh. The other 4 adductor muscles will be covered in another video, so be sure to subscribe to the channel and like the video, so I know that this topic is relevant to you and needs further detailed exploration. So, the pectineus muscle is located above all the other muscles that perform hip adduction. At the top, it attaches to the pubic crest, and at the bottom, to the pectineal line of the femur. The pectineus muscle is responsible for hip adduction and also plays a role in flexing the thigh at the hip joint. Tension areas in the pectineus muscle can provoke pain in the groin, especially during hip adduction. Pain may radiate to the hip and thigh. The developing weakness of the muscle is combined with limited mobility and can lead to the formation of a characteristic gait in which the person avoids stepping on the affected leg. If you stand on the opposite healthy leg and try to adduct and flex the painful leg as much as possible, you will feel pain in the groin at the end of that movement. You can also perform a simple test for self-diagnosis of issues with the pectineus muscle and other adductor muscles of the thigh. Sit on the floor and bend one leg, trying to bring your foot as close to your pelvis as possible. If your foot touches the perineum and your knee is on the floor, your muscles are fine. If your foot only rises to the level of the knee of the straight leg, and the knee of the bent leg is high off the floor, the adductor muscle of the thigh urgently needs your attention. If the pectineus muscle is highly tense on one side and shortens, it can pull the pubic bone towards the corresponding femur and contribute to pelvic tilt. Trigger points in the pectineus muscle can occur as a result of losing balance or falling. Muscle overload can be caused by long-distance running, playing hockey, or rollerblading, which, by the way, happened to me one day when I put extra strain on my adductor muscles. For football players, groin pain is often related to overstretching of the pectineus muscle. This happens at the moment of the leg swing before striking the ball. Groin pain can also be triggered by horseback riding or even completely harmless actions. For example, when you get into a car, get out of it, or sit for a long time in a deep car seat. Excessive desire to do the splits with poor flexibility. A stride that is too wide or regularly lifting a straight leg, which often happens in the military, can lead to characteristic groin pain. During sexual intercourse, especially in women, the pectineus muscle is intensely stretched and contracts strongly. The pain that arises afterward in the groin and on the inner surface of the thigh can lead to thoughts of gynecological issues, rectal diseases, or bladder problems. The same trigger points in men suggest that they might have issues with the rectum, bladder, prostate, or that they could have a groin hernia. Trigger points in the adductor muscles of the thigh can appear due to hip joint diseases, as well as after surgeries on the hip joint. Inequality in the length of the lower limbs, uneven halves of the pelvis, and prolonged sitting in a squat or with crossed legs can also lead to issues with the pectineus muscle and the development of characteristic pain. You can help yourself at home by applying mechanical pressure to the trigger points of the pectineus muscle and other adductor muscles of the thigh, followed by stretching the muscles. While standing, slightly move one leg to the side and turn your foot outward. Locate the pectineus muscle right under the inguinal ligament. Massage the area where the pectineus muscle is located with the fingers of both hands for 1-3 minutes. Then repeat this massage technique on the other leg. You can provide an even better quality massage effect on the adductor muscle area using a large massage roller. Lying on the floor, bend your leg at the hip joint at a 90-degree angle and place the massage roller under the inner thigh. While resting on your elbows, move your leg back and forth for a few minutes, massaging the adductor muscles of the thigh. Then take a large massage ball and massage the inner thigh again. If you find a tight spot in the muscles that causes increased pain when pressed with the ball, stop for 30-60 seconds, breathing calmly through your nose. Then massage the bent leg on the large massage roller for a few minutes, after which fully repeat these exercises on the other leg. The main function of the pectineus muscle is to adduct and flex the thigh at the hip joint. To stretch it, you need to abduct the thigh or extend the thigh at the hip joint. The simplest exercises for hip abduction and stretching the inner thigh at home are as follows. Take 2 chairs, abduct one leg to the side, and place the foot of the straight leg on the chair. Hold on to the back of the second chair with your hand to maintain your balance. Then bend the supporting leg until you feel a gentle stretch along the inner side of the raised thigh. Hold this position for 1 to 3 minutes. Breathe calmly through your nose. Do not lean your torso forward and do not push your hips back. Keep your torso and raised leg in one plane. Repeat this exercise on the other side. A similar exercise for both legs can be done next to a wall. Sit next to the wall sideways and lie down on the floor. Lift your legs up and turn your pelvis towards the wall. Slowly spread your legs to the sides and feel the stretch in the inner thighs. This exercise is great because you hardly need to exert any effort in the final position, as the weight of your legs and the gravity of the earth help stretch the adductor muscles of the thigh. Hold this position for 1 to 3 minutes, maintaining calm breathing through your nose. Then bring your legs together, rotate your pelvis to the side, lower your legs, and return to the starting position. You can also stretch the pectineus muscle while sitting. Sit down on the floor and stretch your legs out in front of you. Then slowly spread your legs to the sides and feel the stretch in the inner thighs. Stretch gently for 1 to 3 minutes and avoid any aggression towards the muscles and ligaments. You can combine the fixation of the final position in all these exercises with the method of post-isometric relaxation. When you inhale, your eyes look up and the muscle tenses, and when you exhale, your gaze goes down and the muscle relaxes. To stretch the pectineus muscle along the line of extension at the hip joint, you can do the following exercise. Get down on the floor on your knees, bend one leg at the knee, and place it in front of you while extending the other leg back. To maintain balance, your feet should be shoulder width apart. Feel the tension in your muscles. Hold this position for 1-3 minutes and avoid creating a curve in the lower back. To enhance the stretch, you can place the back leg on the toes and straighten it at the knee. To stretch the pectineus muscle and other adductor muscles of the thigh even more, press the heel of the back leg to the floor and lower your pelvis further down. If these exercises are somehow unattainable for you, try doing a simpler exercise that uses a bench for support. Since the pectineus muscle is functionally connected to the iliopsoas muscle and helps to flex the leg at the hip joint, an exercise that extends the leg at the hip joint will also stretch the iliopsoas muscle, which we will discuss in a separate video. Subscribe to the channel and turn on notifications for new posts so you don't miss this important topic. In addition to the therapeutic exercises described above, it's also important to pay close attention to correcting the body's biomechanics. It's important to eliminate any inequality in the length of the lower limbs or halves of the pelvis. When sleeping, it's important to place a pillow between your legs to prevent prolonged tension in the adductor muscles. You should sit up straight and avoid crossing your legs or positioning your knees higher than your hips. Trigger points in the pectineus muscle are rarely found in isolation and often occur alongside trigger points located in functionally related muscles, the long, short, and large adductor muscles, the gracilis muscle, as well as in the iliopsoas muscle. You can find detailed reviews on these and other muscles in this playlist. I would be sincerely grateful if you could share this video with your family and friends who are experiencing groin pain. I wish you a speedy relief from pain, and I'll see you in the next videos.